Hello, and welcome to this forum with the candidates for the Marin Healthcare District Board, brought to you by the League of Women Voters. I am a League member, Ann Laser, and I'm the moderator. And we have a League member, Joan Brown, who is our timekeeper. The candidates with us today are running for a 4-year term for the Marin Healthcare District, and they are Larry Bedard, Evelyn Foster, Jennifer Hershon, Jennifer Rienks, Joe Salama, and Michael Whipple. The candidates have been invited to make opening statements of 1 minute, and we will begin with Larry Bedard.
I'm Dr. Larry Bedard. I'm currently the chairman of the board of the Marin Healthcare District. I'm up for re-election November 4th, and I ask you for your vote. Since 2006, when Jennifer Rienks and I were elected to the Marin Healthcare District, both the district and the hospital has made remarkable progress. We ended 20 years of discord and disharmony that characterized previous healthcare districts. In 2010, we became an independent, standalone hospital. The hospital is doing well financially. We've received several awards for the quality of care. 89% of people who get care at Marin General rate it very good to excellent. And recently we were voted one of the top 5% of hospitals in the country, one of the top 250 hospitals. The hospital is moving in the right direction. I urge you to vote for the new lease, Resolution R. Thank you.
Okay, Evelyn Foster.
Okay. Thank you for inviting me to attend the League of Women Voters Forum. I'm a 30-year resident of Mill Valley, and what I will bring to the Healthcare District Board is business background. I have worked in large companies, including Levi Strauss. I'm experienced in creating environments that support both the workforce and the company to be successful. I'm experienced with meeting financial goals and profitability targets. The primary issues for Marin General Hospital are improving quality of care, reversing privatization of the hospital, and ensuring the hospital finances, including the $670 million bond expenditure for the rebuild of the hospital, are managed transparently. I oppose Measure R, which leases the hospital for another 30 years to the private Marin General Corporation. This lease allows conducting all business behind closed doors, and this is not in the best interest of the community. Thank you.
Jennifer Hershon.
Hello, and thank you for inviting me to address the League of Women Voters. My name is Jennifer Hershon, and I am a nurse. I'm a nurse leader. I'm looking at today, not the future, when a woman is in a place to effectualize what we all know to be the business at hand. Women and men in equal partnerships is a bipartisanship that I can support. The issues at Marin General Hospital and the importance of the Healthcare District Board need to be forefront in this campaign and for every Marin County resident, where the patient is the center of the election, not politics. What we don't need is any politicians. We do, however, need leaders that understand what it means to be a public servant. Marin General has 4 paramount issues that need to be addressed: patients and quality, nurse satisfaction, the hospital executive board, and the overall community of Marin County. Your loved ones deserve a safe, quality patient experience. Without the stability of these, care will suffer. Thank you.
Jennifer Rienks.
Hi, my name is Jennifer Rienks, and I was first elected to the Healthcare District Board in 2006. I'm on the research faculty at the University of California, San Francisco, and the Associate Director of the Family Health Outcomes Project there. There I spend time researching public health issues and training local public health departments. I was elected in 2006, and we've managed to accomplish a lot since that time. We've paved the way for a smooth transition from Sutter Health back to district control. We appointed an expertise-based operating board to oversee the day-to-day operations of the hospital. And most importantly, we've now passed a $394 million bond measure, which will enable the hospital to be rebuilt to the highest safety standards. And not only that, it'll be a modern, state-of-the-art green facility that you and your loved ones will be able to count on for 30 years, 40, 50 years to come. I encourage you to vote for myself, for Dr. Larry Bedard, and for Mr. Whipple to continue the stability that we have achieved in the last few years as we've run Marin General Hospital together with the private operating board. Thank you.
Joe Salama.
Thank you. My name is Joe Salama, and I've run for this position before. And last time I ran, I talked to you about accountability. I talked to you about conflicts of interest at the hospital. And I didn't foresee last time I ran that things could get a lot worse than even I had thought at that point. Since I was last running, the hospital has had 30 times the number of formal complaints filed with the state of California, 11 times the number of reported quality of care incidents, and 3 times the number of state enforcement actions. This isn't about me, this is about the hospital and the county. Over 13 enforcement actions have taken place for hundreds of thousands of dollars for avoidable deaths at Marin General Hospital. Why is this happening? Because the lease in place allows for conflicts of interest. There was a lawsuit just filed against the existing board and the CEO showing these conflicts of interest. The cat is out of the bag, and we need to change things now.
Okay. Michael Whipple.
Hi, my name is Mike Whipple. I'm a CPA. I've been practicing in Marin since 1977. Over the last decade, I've spent hundreds and hundreds of hours on the district board and hospital affairs. First as a treasurer of the Alliance to Save Our Hospital, and then as the chairman of that, active in the election of all the current members of the board and support all that they've done. I've studied all of the agreements that are the subject of these debates, I've also, since the changeover from Sutter, have been on the hospital audit committee. Just give me access and insight to the inner workings of the hospital. Those are insights that none of the other candidates have, and I think that they'll bring a great deal to the district board. I've also been a patient many times at Marin General through all its iterations of management, and I can tell you it's a lot better now than it was. Thank you.
Thank you. We'll start with you, Evelyn. Tell us a little about your personal and professional background that would relate to the issues with Marin General Hospital.
Yes, thank you. Working with Levi Strauss, there was a dynamic of really ensuring that there was employee satisfaction and that the company was also profitable as well. And so I've had quite a bit of experience in balancing those two things, which I think would be compatible with Marin General in terms of the employee dissatisfaction, especially with the nursing group and the management.
Okay. Jenna.
I'm a nurse. I was actually a nurse at Marin General for a period of slightly over 2 years. When I started my tenure as a manager at Marin, I had a group of 12 nurse leaders that were with me. Today, all but 2 have gone. What that speaks to is the inability of middle management to effect support from senior leadership at the hospital. Middle management is essential for carrying culture shifts forward and employing metrics that improve patient quality and safety. I echo Evelyn's sentiments that what the hospital needs now is they need someone who has some familiarity, they understand what nursing's about, and they know the best way to improve patient care.
Jennifer.
I've been working in public health for the last 18 years, and what I bring to this is a deep understanding of population health and actually how to improve the health of the community. Increasingly, hospital care is not the center of the universe anymore, and more we're seeing care moving from outside of the hospital into the doctor's office and into the home. Increasingly, the emphasis is not just on health care and care for sickness, but actually on wellness and promoting wellness. Increasingly, that's what we're going to be focusing on both as a hospital and a district, is how do we make our community community as healthy as it can be. So ultimately, people really don't need very many hospital services. So that's the main focus. I've also been on the board for, at this point now, 8 years, so I have a deep understanding of all the issues impacting the hospital. I've had a lot of education regarding what's happening in the healthcare field, attended many conferences, and have a deep understanding of what's going on with the Affordable Care Act and with accountable care organizations, and I bring that to the table.
Joe Salama.
Thank you. I'm a mediator, and what that means is people come to me with problems and differences of opinion, and I help them work through their problems. I've helped solve hundreds of cases in this way. And I think with the differences of opinion of the people in this room and the differences of opinion at the hospital, this is something that can be very valuable to the hospital. As well, I'm an attorney, and I'm familiar with conflicts of interest laws. I'm familiar with codes. I'm comfortable reading those. I'm comfortable putting those into policy and exercising them effectively and ethically.
All right. Michael Whipple.
I've been fascinated by the economics of healthcare delivery system and its evolution over the past decade. Studied it a great deal. I've really enjoyed my time on the audit committee because it's given me access to the inner workings of the medical reimbursement systems, the differences between what certain populations, Medicaid, for example, or Medicare or private insurers, pay for the same services, and the effect that the Affordable Care Act is having on the hospital's finances right now. It's a critical time for the hospital. It has excellent management. It needs stability at the district level because the financial situation is in the entire country for all health care is in limbo. And we need the kind of people that have experience and can respond to the challenges that are before us right now.
Larry.
Yes, I was the first board-certified emergency physician to practice in Marin. I ran the emergency department at Marin General Hospital for over a decade, was the first medical director of Southern Marin EMS. I think I've earned the confidence and trust of medical staff, myself, Jennifer, and Mike, of the endorsement, chief of staff, and at least 100 different physicians. I've always been involved in my community. I was president of the Marin Heart Association. We had a local heart association. Been on the board of the Marin Medical Society for more than 20 years, president of the Medical Society. When I saw a patient as an emergency physician, I had the best job in the world. Good doctors, good nurses, mediocre facility, but great patients. And it really pained me to see kind of the character assassination of the nurses and the doctors at Marin Hospital over the years, continuing with Joe Salama.
All right. The next question, how would you explain to a newcomer in Marin County, what are the principal functions of Marin General Hospital Board, and how do these functions differ from the functions of the Healthcare District Board? Jennifer.
I think it's my turn. Thank you. It is a convoluted and challenging question because I do think many of the voters are very confused about the functionality of the two boards. The hospital board functions, in my view, in a silo from the Healthcare District Board. The privatization of the hospital board allows for possibility of limited information being transmitted to the Healthcare District Board. The Healthcare District Board is relatively impotent to affect change, to turn the tide, and is not able to select members of the hospital board.
All right. Next question.
Yeah, same question. Okay,
Okay.
we have a two-tiered governance structure for the hospital. We have a publicly elected board, which has appointed and approves members of a private operating board that's expertise-based. So it's a two-tier governance structure. The private operating board is charged with overseeing the day-to-day running of the hospital and working very closely with the executive team. The district board is in charge of setting broader policy and financial direction for the hospital and basically being the overseer of what happens at the private board level. So we regularly review minutes and agendas of those boards. We get regular reports from our CEO. We have quarterly financial reports and hospital reports that are available to the public that they can see. The district board could run the hospital, but when the hospital came back to control in 2010, strategic planners came in and looked at the situation, and they said the best chance for Marin General being successful and surviving into the future is to have a two-tiered governance structure where you have a publicly elected board overseeing a day-to-day operating board that is expertise-based.
A lot of what Jennifer said on my right is very accurate. What she didn't say is that the private board, the non-elected board, so we have the elected district board and the private hospital corporation. The private hospital corporation is allowed to have conflicts of interest, and they do have conflicts of interest. And the result of that has been that a lot of the members of the board are making deals with public money to themselves and writing contracts to themselves, basically. And there is very little oversight. I disagree with Jennifer about that. According to the bylaws, their transactions are secret, and nobody can review the records of the transactions without signing a non-disclosure agreement. So the reason this is particularly important is because Measure R is on the ballot this November. And a no on Measure R will end this setup and allow for accountability and transparency of all the spending of your money.
Okay.
Well, first, the statement that these conflicts of interest are not looked at is totally wrong. I tell you, from the audit committee, the conflicts of interest. This board is of the hospital is very active, and just exceptional quality. It's incredible how effective they have been. An elected board doesn't have the expertise to run a hospital. To run a hospital in a public forum could be extremely risky to the health outcomes for the population. It's not good at all. On the big issues, though, if you look in the bylaws of the hospital is restricted from the things that it can do that could cause damage to the district. You can't spend more than a certain amount of money. You can't assign its operations to other entities. And the hospital is owned by the district. It's not owned by somebody in Sacramento or somebody in Texas.
Well, I think what we're seeing here is really pure and simple McCarthyism. You know, Joseph McCarthy, there's communists, there's people who are disloyal. That's what Joe Salama stands for. You know, there's people out there, they got these side deals, they got conflicts of interest. Joe, for you to be honest and transparent, you need to tell us your conflicts of interest. On your website, you brag about being predominantly malpractice attorney. Have you served any nurses in Marin? Any nurses at Kaiser? Any nurses at Sutter? What doctors have you sued? What hospitals have you sued? We have a conflict of interest policy on the bylaws. The thing that really surprises me, the three of you, we had 10 public meetings on the lease. You didn't attend a single one, did you? Joe has not attended a single board meeting in 8 years. Evelyn, if you want to learn about finance, we have a finance committee meeting now you got innuendos, lies, distortions, McCarthyism.
Thank you. The relationship between the two boards is practically nil, and I think what has been described here on the part of Jennifer is really for your information type. There is no decision making on the elected board. They will have no role. In fact, I understand you're planning to meet less frequently because you have nothing to do. And so there is no real interaction. The model for district hospitals is to have an elected board run the hospital. There's nothing wrong with that. They are very capable of doing that. In fact, I think there's probably over 80 or 90 hospitals in California that are being run with elected boards. So, thank you.
All right. So, and this is with this Jennifer. Mm-hmm. What role should the healthcare district play in the construction of the new hospital?
The Healthcare District Board is going to be the group that actually approves the construction of the new hospital, and we will be approving all the plans for the new construction of the hospital. We've been entrusted by the voters with a $394 million bond measure, and we will ensure that there's a tremendous amount of transparency of where every single one of those dollars goes, and that all the plans for the hospital will be shared with the public as they are being developed.
All right.
That will be our role.
Joe.
Thank you. I want to respond to some of the comments Dr. Bedard made. Just so everybody knows, I used to defend doctors in Marin County for a year and a half. I do have one plaintiff's case for a dear family friend, and that's in Sacramento. I've never sued the hospital, and I have no intention of suing the hospital. Dr. Bedard, actually, I think you were there because I saw you and I sat really close to you at the last board meeting where we talked about the new advertising campaign for the hospital, and you invited public comment. So I do go to the meetings. The problem is a lot of the important things aren't done at those meetings. They're done by the secret board behind closed doors. And in response to Ann's question, the building of the new hospital and the spending of the money is largely going to be happening behind closed doors. That's in the bylaws. You can go look it up yourself.
Okay. Michael?
It's not in the bylaws. Read the bylaws. It's not in, there are two sets of bylaws. It's not in either one of the bylaws. As a matter of fact, if you spend over $20 million, you have to have the express approval of the district board, and that approval can be withheld. It doesn't have to be, it's not one of those cannot be unreasonably withheld things. The district can do whatever it wants. So obviously $394 million has to be approved by the hospital. The design of this hospital building is quite remarkable. I was worried early on that especially in the Sutter era, that we were going to build a monument to healthcare of the past. But if you come to the public meetings and you'd see the designs that have been presented several times and how it's evolved, the flexibility of the building and the way that it accommodates the possible changes in the way that healthcare would be delivered. For example, you get a hip replacement and outpatient surgery now. Well, that's one less room you need for somebody to stay overnight in the hospital. So those pieces get repurposed.
Okay. Larry?
Can you repeat the
Yes,
question?
I can. Just a minute. What role should the healthcare district play?
I mean, first of all, the healthcare district, I think, has had an on-hands role. We have approved every major decision. Virtually all of them were unanimous. We picked the architect. Jonathan Friedenberg made over 100 presentations to the community. We held 10 public meetings. Now, Joe's been to one meeting, and I'd like to ask Evelyn and Jennifer just how many meetings you've ever attended. I want to thank the voters in Marin because they passed the bond last year, I think showing confidence in the direction the hospital's moving. And I can tell you in October, based on somewhat a recommendation, we're going to have periodic meetings in which the architects and the board and the public's all going to be invited. So maybe in October, I'd invite you to the next board meeting. Before the regular meeting, there's a half an hour special session, new hospital. It's going to be great.
Okay, Evelyn, what in your what do you see as the role of the district board in the construction of the new hospital?
Right. The healthcare board should have an integral role in what is happening with the hospital. But first of all, one of the things I was really surprised about that the hospital was not more upfront about is this $394 million bond issue really has a substantial interest cost to it of somewhere around $275 million to $300 million. And I was just wondering why there was never any really support for disclosure so that the taxpayer and voter in Marin would know that they're really taking on a debt over the next 30 years for about $700 million and not for $394 million. So the question I would really like to ask the board is, why did they not sponsor the truth to the taxpayer?
Thank you, Ann. I appreciate Dr. Bedard's passion. It's nice to see amongst physicians. In terms of the construction of the new hospital, I have already been involved in the early days of preliminary planning for surgical services, outpatient surgery services, and the recovery areas of the hospital. So that was a great effort working with the architects, and nursing was never really involved. The patients, the nurses delivering care at the bedside were really not part of that planning. So I see my role and the role of the Healthcare District Board as being instrumental in listening to the nurses when the hospitals rolled out, being a voice for their concerns. In the past, they haven't been listened to, and so the nurses, as they care for patients at the bedside, need to have input. Thank you.
Okay. What, in your opinion, are the key priorities for maintaining and enhancing healthcare services in Marin County? And that's for you, Joe.
I think you could probably guess my answer to that, and right off the bat, I think the important thing is for the conflicts of interest provision of the bylaws, which is there in section 4.2 or 4.21, needs to be removed. I think that the ability for the person who's sitting on the private board to create a computer system that allows for violation of privacy laws, the ability for self-dealing is important to remove because it's resulting in increasing actions by the state of California. It's resulting in avoidable patient deaths, and it's resulting in increased cost of care. So you're paying a lot more, you're getting a lot less, and there's unfortunately avoidable deaths that are happening.
Okay, Michael.
What should the district do? The district has been trying to bring the health care closer to the community. It's not just the hospital. The district has opened 9 clinics in the county in the last several years. Mm-hmm. They've recruited substantial numbers of doctors, because we have a lot of doctors retiring, a lot of doctors leaving Marin because of frustrations with the cost of living, frustrations they had with Sutter. And we've been very successful in bringing not just specialists, but also primary care doctors to Marin. And with the new hospital, the urgent care center that'll be there to take pressure off of other parts of the healthcare system for the county.
Okay, Larry.
Well, it seems like conflict of interest is obviously a big issue. You know, Joe, you've been practicing predominantly malpractice law for 15 years in Marin County, and you tell me you got 3 cases? Somewhat hard to believe. Now, you're making allegations that people on the hospital board are violating federal Medicare law. You must have some kind of inside information, but I think you're slandering them, and I think you have a responsibility if you say decisions are being made, patients are being killed, insider dealing. It's either pure McCarthyism or put up or shut up. Now, you can go after these people, slander them, but they're doing a wonderful job for this hospital. The 10 people who have worked on that board, I mean, tremendous expertise, tremendous diversity, and that's one of the secrets of our success, and I don't think you should be slandering them.
Evelyn.
Could you refresh the question again?
Yeah, what do you think are the key priorities for maintaining and enhancing healthcare services in Marin County?
Well, one of the things, interestingly, as I've been going around chatting with people about Measure R and my candidacy, I'm surprised at the number of people that say to me, you know, I get my medical care in the city. And I'm wondering, why is that? I think the focus really needs to be on looking at nursing care, having management really support and believe in providing quality care to the patients and community of Marin. We should be building a confidence in the community that we have first-class medical care in this hospital, and that always doesn't come across.
Jennifer?
I think I've already answered that question, Ann, didn't I?
No, you didn't.
No.
You didn't.
Okay.
The key priorities.
I'm out of sync, obviously.
Okay. Key priorities for maintaining and enhancing healthcare services in Marin County.
Well, the priority should be sustained quality of patient care. to speak to Dr. Bedard's comments and in support of Joe's remarks, there actually have been sentinel events at the hospital. There's been 2 in recent years. Both are what resulted in fines by California Department of Public Health and are easily seen by the public on their website. Additionally, there have been lapses in the operating room where surgical instrumentation has arrived to the operative field contaminated with bioburden and bone fragments. This has happened not once but twice, resulting in that function in the hospital, the sterile processing department, being outsourced to an outside agency where it continues to be outsourced today. So the focus really does need to be on quality that's sustainable. Thank you.
Jennifer?
Thank you. We need to work on developing an integrated delivery system, and that's something that we are already currently building. We also need to work on really integrating more information technology to make it easier for patients to communicate with their providers, both on the outpatient side and providers that are on the hospital side. We've been supporting and will continue to support primary care physicians in this county. Primary care is not something that pays for itself, and thus we need to continue to support primary care physicians so that people have access to that care. In terms of the quality of care, that's definitely a function that we will continue to work on and we have been working on seriously for a very long time. In healthcare, quality of care is a major issue, no matter what facility you're on. Every facility is always trying to do better. There have been, unfortunately, a few sentinel events at Marin General, but there have also been sentinel events at UCSF. There have been sentinel events at Kaiser. Fortunately, mistakes happen, and that's one of the things that we're working on, is making sure that those mistakes don't happen again.
Okay, we'll start with you, Mike. There have been several references to Measure R. What is Measure R?
Measure R is a lease. This is what got us into this mess to start with. Right? Everyone agree? There was a lease signed in a 30-year lease signed in 1985, and it went through its problems. The problems were maybe some poor drafting, maybe some evolution in healthcare, but mostly a combination of bad actors. So now it's required by law that if a district leases the hospital to an entity, even though the entity is completely controlled by the district, that it has to be approved by the voters. So this, got to do this quickly. So this lease would then take us from 2015 to 2045, the renewal of it, through the life of the new building. It is not a key to the governance of the hospital. Excuse me.
Okay. Larry.
Sure. One, I support the lease Proposition R. A lot of people are trying to compare this to the previous lease we had with Sutter. I think that's deceptive and dishonest. That was a lease between the district to a healthcare system that had 23 hospitals that was headquartered in Sacramento, where hospitals were considered to, doing well. You would contribute one that it was having a poor. This lease is completely different. We're essentially leasing it to ourselves. There's one corporate member of the Marin General Hospital Corporation, that's the district. The purpose to lease it to ourselves is because it allows a successful governance structure. What we have now is a unique private-public partnership. It maintains this board of expertise and excellence. It's also to our financial value by having this lease because it improves our credit rating, cutting down the interest we may have to pay for GO bonds, and also we're going to try to reach out for revenue bonds.
Evelyn.
Right, thank you. Measure R is simply a mechanism to allow whoever has the lease to operate in a confidential manner. That there's no disclosure to the public. Let's see, what do I want to say? Excuse me. When you lease to yourself, it's like, why would you do that? There has to be some advantage. There has to be some confusion. that you can relay to people because it's something you don't normally do. This thing is very difficult to explain to people because it's like you normally don't do this. And the only intent that I can see, it allows you to operate behind closed doors.
Jennifer.
Thank you. And I echo Evelyn's sentiments that the lease proponents say that this will allow for community-owned, but really it's would be governed by an unelected board of directors picked by the CEO that controls Marin General. Locally governed means those people who are elected by the residents of Marin County. The hospital, we understand from previous sources that the hospital is under consideration to be leased back to Sutter and/or Dignity Health, that there's discussions going on as we speak in that regard. Marin residents own Marin General. We expect the directors to oversee it as they do in other districts. Thank you.
Jennifer.
Thank you. Marin Healthcare District does indeed own Marin General Hospital, and we have a two-tiered governance structure where we have an elected operating board overseeing an appointed expertise-based operating board. So we have a oversight board. So we have a publicly elected district board overseeing our private expertise-based operating board. I do support Measure R. Measure R is what will enable that relationship to continue. Currently, we have a couple of doctors on the district board, me, who's a PhD and an expert in public health, and somebody who's an attorney. Depending on who you elect any given year, you may or may not have the expertise you need to actually effectively operate that hospital board. By having an appointed board, that board has a tremendous amount of stability and it's expertise-based. District board members are they help nominate and approve all the members for the appointed board. The district board also regularly reviews hospital reports that are required from the operating board to the district board. There's a tremendous amount of oversight. The two boards work very closely together.
Okay. Joe?
I think more important than the particular candidacy of anybody in this room, Measure R is probably the most important thing on the ballot in 30 years. Despite what you've heard earlier, it's not required to be passed. If it doesn't pass, this two-board situation crumbles, and there has to be more accountability. And a no on Measure R will ensure that accountability. You know, I'm not here for my own personal fame or glory. I'm here because when I found out what's happening at the hospital, it really sickened me. And in response to Dr. Bedard, I'm not making this up. You can go look at the case of Dennis Mondragon versus Lee DeMonico, Marin Healthcare District, and Prima Medical Group, filed on September 17th, 2014. And you can see what happens when there are conflicts of interest. You can see why patient care is falling. That's Marin County case number 1403531.
Larry, how would you assess the district's ability to provide health care services for the uninsured and the underinsured population of Marin County?
Once again, I think we've done a tremendous job. Marin General Hospital is the only full-service acute care hospital in Marin County. I ran the ER, it's open, we see everybody insured, uninsured, whatever. In fact, that's Marin General sees a disproportionate number of poor people when you consider Sutter and Novato and Kaiser. I think the biggest thing we've done is opened up 9 primary care clinics. We own the clinics, the hospitals manage it, we contract with the physicians are obligated to take care of people on Medicaid or poorly insured. They back up the emergency department. I think we've stabilized health care in Point Reyes with our clinic there. We just recently hired another clinic physician to serve patients up in Novato who come to Marin General Hospital. So we're a big supporter of the Marin Community Clinic. We gave them, I think, $400,000 last year. So we met the community needs in spades.
Thank you. Clearly, every individual has a right to health care, and the uninsured need to be treated at our hospital or any other hospital. What would really be a good resolution for this is a single payer system where everyone is insured and this doesn't become an issue of having to find ways to fund medical care for the uninsured.
Okay.
I think Dr. Bedard underscores very nicely how well Marin General has done with serving the under and uninsured members of our community, and more of that needs to continue. There's been a fabulous job done with the community clinics. The mental health facilities probably could use a little more funding and work there, since the mental health facility at Marin General does support the large Bay Area Marin-Sonoma League, and there is no adolescent psych facilities in Marin County. You have to go to the city for that. So a continued, while it might not be a mission to serve the poor and underprivileged, Marin County and the healthcare district has been doing a good job with that so far.
Jennifer?
I think this is something that actually we all agree on, and Marin General does do a good job supporting the poor and the underserved in the community. In fact, in many cases, we do more of a job doing that than either Sutter or Kaiser does. Not only do we support taking care of those patients at our hospital, but we also fund the Marin City Health and Wellness Center, the Marin Coastal Health Alliance, and Marin Community Clinics, in addition to our primary care practices. So we're doing a lot, and we will continue to do a lot to ensure that healthcare is accessible to everybody that needs it. I did want to touch briefly on how other hospitals are governed, because I think it's important for people to understand that. Both Sutter and Kaiser, neither one of those hospitals is governed with the publicly elected board. UCSF is not governed with the publicly elected board. In fact, most hospitals in the state of California and most hospitals in the nation are not governed by publicly elected boards. Healthcare is an incredibly complex, competitive industry. It is not a government. Electing politicians to basically run your hospital is not going to give you the best chance of the hospital being successful. That's why I support the two-tiered operating structure.
Joe?
Can you ask me the question again, please?
Okay. How would you assess the district's ability to provide health care services for the uninsured and the underinsured?
Thank you. I think that the ability of the district to do that is, again, somewhat compromised by how it's spending its money. For the ability to do that, it would need to provide discounted, subsidized, complementary care of some sort. So, and that's right, and maybe you do that. But with a lot of the spending of the money going where it's going, it's definitely something that they need a 400. I'm sorry, Dr. Bedard.
Larry.
I'm sorry, Dr. Bedard, that you
have
have.
a lot of money on laws.
I'm sorry that you need to feel the need to personally attack me because you're so insecure about your position on the issues. Please don't do it again. As I was saying, though, that the money that is being spent for people writing contracts to themselves, the money that is being mismanaged severely compromises and hinders the hospital's ability to provide higher quality care to people who don't have the ability to pay for it.
Michael.
Poor Joe is so untrusting to this fellow man. The access to the care has never been a question. Marin General, that's its charter. It is the place you go if you can't pay in Marin County. One thing has changed very substantially since we took the hospital back 4 years ago. That used to be that the poor person or somebody who couldn't afford to pay the hospital bill, it quickly went to collections. Now when you get the bill, you get with it a financial aid application. The hospital last year took in about $350 million. The amount that it forgave from people in those situations, over $20 million. That's a substantial community benefit.
Okay. I gather that there's a shortage of doctors who practice as family physicians. How can Marin County help attract more new doctors who want a career as a family physician? And Evelyn, you first.
Thank you. I think one of the key things is for the hospital to have a reputation that it's a great place to work, that the physicians are supported, that there's quality of care delivered, that if you come to Marin General, it will be a great experience for you. And I think the hospital has a reputation at this point with doctors that perhaps that isn't the best option for them. And until we change some of the practices that are going on, we will not be able to change that reputation of the hospital as a great place to work for physicians. Thank you.
Jennifer.
In the most recently attended board meeting, there was a great campaign afoot to shift the focus on healthcare to one of wellness in the community. Marin General is actively working on this campaign. I think that focus has been successful in other models. We all know the jingle, the Thrive jingle of Kaiser. But family physicians that want to bring their family here to live and work in the community needs to be supported by a hospital board that encourages not the focus to be heads in the bed, but wellness before. Thank you.
Jennifer?
Thank you. I actually work in the Department of Family and Community Medicine at UCSF, and one of the big charges of that department is actually training the next generation of family physicians. Family physicians are facing a lot of struggles these days. One of them is the low reimbursement rates that they basically get paid. So unless we're willing to subsidize family physicians, we're not going to be seeing a lot of them. That is something that we are doing, though. We are subsidizing family physicians. We're bringing in primary care physicians to the county, and we are helping to subsidize their income so that they can afford to practice here in the county. The other thing that we're doing to create and expand the physicians is creating a very stable work environment. It's really important for physicians to know how their hospitals govern, and that's going to be governed by a very stable board if they're going to be coming and basically setting up practice in your community. That's a big investment for them, and they want to know that they're going to be able to be successful and that the hospital and the community where they're at is going to be successful. Another key piece to attracting this next generation of physicians is building a state-of-the-art hospital. When physicians are deciding where to practice, quality of life is important, what they get paid is important, but also where they're going to practice is incredibly important.
Joe.
Thank you. I echo what Evelyn Foster said, and I think that if you build it, they will come, just like in that movie, Field of Dreams. I think that if the hospital is a desirable place to work, if the quality of care situation changes, if patients are all happy with their experiences there, if the cost of services doesn't cost between 3 and 8 times higher for an x-ray than it does a few blocks away, I think once the situation at the hospital improves, it will be easier to attract good qualified family medicine practitioners.
Michael.
I like Jennifer Rienks' answer the best. The district, if you'd been at June's meeting, or at the meeting you were at, they approved 2 contracts for doctors that had been recruited. And if you look at those contracts, what you'd find is what you always find is the biggest problem getting somebody to Marin, and I've worked with doctors at Marin, I can tell you, is it costs a lot of money to come here. And the money you make as a family physician, you're not talking heart surgeons here, you're talking family physicians. It's very hard to get a high enough gross income that you can pay your student debt and buy a house. So it takes a real outreach. You have to sell them on Marin, and you have to provide financial aid to do that. The district is actively doing that and being successful at it.
Larry.
We did build it, and they came. We opened up 10 primary care clinics. If any of the 3 of you would have bothered to go to any of the board meetings, the finance, the lease and build it, you would understand we've been very successful. That was a major complaint in our lawsuit against Sutter. They did a poor job in recruiting physicians. The district has done a great job. Look at the number. We just recruited one very difficult, Novato, because guess what? No hospitalists. So they have to get up and do their own call at the hospital. So I think we have a plan. We're executing it. It's going very well. We have recruited numerous primary care physicians. Sorry to be so animated.
Jennifer, are you the next one?
Yes.
Yes, you are. That's what I thought. Can you tell people what the specific relationship, effect of the Affordable Care Act will be on Marin General? That is commonly known as Obamacare. Do you know how it's going to work in here?
I think we're all seeing that every day. currently already? It's a very good question, one that's very far-reaching, in fact. The hospital has struggled, as do most acute care hospitals, where their model is reliant upon census days and patients in a bed. The models of other hospitals that are less dependent on heads in a bed and more focused on keeping patients out of the hospital are the ones that are going to survive in today's climate. Thank you.
The Affordable Care Act is already having a number of impacts on Marin General. First, we're seeing more patients that have Medi-Cal now coming to the hospital. They now have access to services that they didn't have before. That's changing the payer mix for the hospital a little bit, and that's something we're going to continue to have to be mindful of in terms of trying to deliver the best care we can as efficiently as we can. The other impact is that it's having is it's really forcing the alignment of physicians with hospitals and forcing us to look at how we might partner with other institutions so we can share services with them, share equipment, develop economies of scale, and really look at how we can together become affordable care, become basically accountable care organizations where we're going to be responsible for covered lives and basically keeping people healthy instead of filling hospital beds. So that's one of the things we're working on, with working with Prima Medical Group, working with healthcare districts to the north, working with our local physicians. We're building that integrated delivery network that is a key to the Obamacare. The other key thing that we're working on is really working on prevention services and looking more broadly at community health and how we keep people healthy.
Joe.
Thank you. I think that the Affordable Health Care Act has resulted in more people being insured. And although it's not everybody, there still is a large uninsured number of people. That is more, those are more insured patients that can go to the hospital, and the hospital can get basically paid for those services, whereas they couldn't before. So I think that's good for the hospital, and I think it's good for those who now have insurance as well.
Okay. Right.
The immediate impact, it has been a negative one in that the population, the census for the hospital has, the insured population as a percentage has dropped, and the Medi-Cal population has increased. Medicaid pays about 11% reimbursement of the nominal rate. Insurance company will pay 25 or 30%. It'll take a few years before that balance is mixed up, because also you should consider, but we can't measure yet, that more of these Medicaid patients will be hopefully mean fewer free care patients. So there's a balance in there. But long term, what it means is that the systems are going to become outcome-based and not process-based, and so that we should get better outcomes, and it should cost less to do it. So we should be able to do it for more people more effectively.
Larry.
Yeah, I think it's obvious we all have mentioned the impact. Most people who sign up for Obamacare actually get on Medicaid. Marin General's basically the Medicaid provider, so the volume has gone up. Unfortunately, you may lose every time you admit a Medicaid patient, so you can't make it up on volume. So it might need to have some, but I think part of the reasons for having an expertise-based board is they were well prepared for Obamacare. For example, we set up an accountable care organization, which is where you're going to have a group of physicians bid on and take care of a population of patients. We've already set it up, one of the first in California. Our physicians, the cardiologists, actually had a program linking doctors' records to hospitals' records. We got it federally qualified, and that was one of the first in California. So having people who really understand healthcare, such as Gene O'Connell, the CEO of San Francisco General, were well prepared for Obamacare.
Okay. Evelyn.
Thank you. My understanding, of course, is that the act would bring more people into the hospital. I think that's been commented on. And I was wondering how that would reflect on the previously announced 3% cost reductions for the hospital. If we're going to be having more insured patients come into the hospital, how are we going to deal with treating them and taking care of them appropriately if we have a plan currently to reduce costs of the hospital by 3%? I'm just unclear how that's going to work.
Okay. This is going to be the last question. And it asks you to take a long-term look at healthcare in the district. Besides those that have already been discussed, do you have any initiatives that you think would be important to achieving your long-term vision for the future of the hospital?
I think we start with Jennifer.
Yeah,
we just started with
I think it's you,
No,
Evelyn.
it's you.
It is.
Just start? Okay, great. All right, wonderful. Long-term vision for the hospital. We need to work on continuing to develop our services basically out of the hospital. As in healthcare is shifting from the hospital to the physician office to the patient home, we need to be really looking at what we're doing. It's no longer a hospital-centric world anymore. So we really need to be looking at how we can deliver more care in the physician's offices and at the home. And we need to really meet people where they're at in terms of keeping them happy and healthy and well. The other thing I think long-term we really need to look at is the provision of psychiatric services at the hospital. We've really looked a lot at the clinical services and what's going to be needed for the next 50 years for clinical care, because we're in the process of having to upgrade our hospital to make it seismically safe. But we also need to be looking at mental health care and how we better provide those services, and particularly what can be done on an outpatient basis in terms of improving community mental health so that people don't actually need psychiatric beds as much. This is an issue that's across California. We need to be doing a lot more to meet mental health care needs.
Joan?
Thank you. I think that in order to ensure the best future for Marin General Hospital, a no on Measure R is of the utmost importance. I think you've heard me say it already, and I'm going to say it again in my closing statement. We need to be responsible for how we're spending taxpayer money. It's a public hospital, and transactions are happening. It's not a sustainable business model. It's not a viable structure, and it's going to collapse. It started with this lawsuit, and it started with all these complaints, and if things go in the same direction, it's not going to be good for the hospital. So a no on Measure R to end the two board setup is vital for the future of the hospital.
Michael?
Could you repeat that?
Yes. Looking into the future, the long-term vision for healthcare in the district, are there any initiatives that you think are important for achieving those visions?
Well, the initiatives that are underway, which is to say that despite what Evelyn hopes for, this additional insurance has actually led to lower revenues and higher costs, higher population with less money coming in the aggregate because of the mix. Now where was I going with it? I forgot where I was going to go with that.
Okay. It was, in addition to what has already been discussed, are there any initiatives you think are important in achieving
the things that are underway? So the management that's in place, not just the two board structure, but the people that are in management of the hospital have done an incredibly effective job with the very limited resources to this point. They have brought the healthcare outcomes way above where they were when Sutter was there. Some of these numbers have been cited, but the outcomes have been 100%, 97%, 100%. It's quite remarkable.
Larry?
Well, first and foremost, I really anticipate the opening of a new, modern, state-of-the-art, green hospital in 2020. I mean, that I think is the goal. You want to improve patient satisfaction. Clearly, the simplest, it's not so simple building a new hospital, but having a new state-of-the-art hospital. Every new hospital, there's patient satisfaction scores immediately jump. I think it's actually, we're creating a hospital-based healthcare system because our 10 clinics are tied into the hospital. We own them, they manage them, they operate them, they take the financial risk. We obtained the cardiologist practice, all 24 cardiologists. They now have an office up in Sonoma. So patients from Sonoma are coming to Marin because we're going to be the preferred hospital in Northern California. So I think it's really exciting times. I'd encourage the community to vote for R. I think it's essential to keep the progress going.
Evelyn?
Thank you. The long-term view I would have for the hospital is it can be a magnificent building and can have all kinds of modern equipment, but if the morale of the people inside of it operating that hospital will not change the quality of care. My long-term view is we first need to fix the problems with the people before we fix the problems with the building. And I support no lease. I think that's the one item that should be eliminated for sure to stop all the closed door type decision making, to avoid the conflicts of interest. And again, clearly we need to raise the morale of quality of care in that hospital.
Okay, and Jennifer.
Thank you. First of all, I think there's really no room for the patient when we're all caught up in the politics of it all. I think long-term for Marin County and Marin General Hospital, there are 4 issues that you can liken them to the legs of a chair that help stabilize the hospital. One, I agree with Jennifer earlier, supporting additional off-site care so that patients are cared for, wellness programs so that health is maintained and sustained. Caring for our aging population would be the second thing. We have an incredibly aging population in Marin County and limited skilled nursing facilities to deal with them. The third thing would be sustained quality of care. That is tied directly to nursing and satisfaction. The literature well supports that satisfied nurses produce quality of care. This metrics will produce outcomes that are 100% positive rather than 100% sentinel events. Thank you.
Okay. That ends the questions. Before the candidates make their closing statements, I have some information for the voters. Election day is Tuesday, November 4th. The last day to register to vote or to re-register if you've moved since you last voted is October 20, 2 weeks before the election. Requests for absentee ballots, which are now known as vote-by-mail ballots, must be received by the Elections Department by October 27th, 1 week before the election. Early voting opens at the Civic Center, room 121, on October 6th, 29 days before the election. If you go to the League of Women Voters smartvoter.org website and enter your street address and your zip code, you will be able to see your own ballot with links to the candidates, if the candidates put their information up on Smart Voter, which I hope they will, to the issues, ballot measures, and information about the voting process itself. In addition, our website, marinlwv.org, has many online resources for voters to research facts and campaign finance information. So now the candidates will make closing statements of 1.5 minutes, and we'll start at the end, this time with you, Michael, your closing statement.
Okay. Well, first I want to urge you to vote for Measure R to approve the lease. I want you to vote for Larry, Jennifer Rienks, and myself. We're gonna build on what's been accomplished to this point: the recruitment of doctors, the opening of clinics, the spreading of healthcare, the improvement of the quality of the healthcare throughout the county, and bringing the new hospital structure to fruition. It hopefully to satisfy nearly all the remaining concerns that are left. The main concerns being how can we make the employees happier, because happier employees do better work, and how can we make the patients happier, because happier patients are healthier patients, and the new building and the systems that are part of it are going to go a great ways towards helping us in that regard. So please vote for Larry, Jennifer Rienks, myself, and Measure R. Thank you.
Okay. You next, Joe.
Thank you. You know, I don't want you to believe anything I'm saying tonight, or today. I'm not sure this is live when it's going to air. But
you can watch it on your computer.
there you go. I don't want you to believe anybody in this room. I want you to go to the California Department of Public Health website and look up the fines for yourself and see how they are increasing. This number here is the last 5 years. These are the 5 years before. Google the words deaths at Marin General and read the IJ articles covering those avoidable death incidents and the fines. Go to Yelp and read some of the patient reviews. If I could give Marin General negative stars, I would. The billing there is criminal. They prey on the sick, and it is truly disgusting. So, you know, I'm not an alarmist person. I would love to sit up here and tell you exactly what you want to hear. I don't want to be doing this. But the situation at the hospital is dire, and someone needs to call out the board on what's happening, and it needs to end. This is my hometown. I've been here since 1973. I went to Glenwood, I went to Davidson, I went to Santa Fe High School, I went to Berkeley. I'm just a concerned citizen, and what's happening is alarming me. I think the people of Marin really do deserve better than avoidable deaths. And for the first time in 30 years, the people of Marin County can end the lease and restore transparency. Vote no on Measure R, and vote for Joe Salama, Evelyn Foster, and Jennifer Hershon. Thank you so much.
Jennifer Rienks?
Thank you. It's important for voters to understand that Marin General Hospital was recently awarded by Health Grades, an award that was given out to the top hospitals in the country. Marin General received an award for excellent clinical outcomes. It's an award that's given to the top 5% of hospitals nationwide. Healthcare's looked at 3 years worth of data before Health Grades made that recommendation and gave us that award. So I really encourage people to look at objective data before they make decisions about how they think the quality of care of Marin General is doing, because I can assure you it's excellent quality of care. I also want to encourage you to continue to vote in support for Dr. Larry Bedard, myself, and Mike Whipple. We will continue with the accomplishments that we've made thus far. We will ensure that we have a stable operating structure for the hospital going forward. Many of you out there own your own businesses, and you know what it's like to work in a competitive business environment. I want you to ask yourselves, would you want your business run by a publicly elected board of people that may or may not know a lot about what it takes to run your business? Or would you want to have your business run by an expertise-based board? I also want to let you know that I've received a number of endorsements, including endorsements from Congressman Jared Huffman, endorsements from Supervisor Katie Rice, Supervisor Judy Arnold, Supervisor Steve Kinsey, and Supervisor Susan Adams, who is also a nurse. I've received the endorsement of Paul Cohen, Chair of the Democratic Party, of Patrick Bennett, Chief of Staff of Marin General Hospital, Dr. Peter Eisenberg. I've also received the endorsements of the Democratic Central Committee of Marin, the Marin Women's Political Action Committee. Thank you.
Jennifer.
Thank you, and thank you for your time viewing this program. I am a nurse, first and foremost, and a nurse knows what's needed at the hospital. The legs of the chair are broken at Marin General. Quality of care is suffering. Nurse satisfaction is down. The hospital board is essentially a private board, a very well-educated board, but private nonetheless. The community interest needs to be continued to be supported by the utilization of those that you elect to be your voice. I've said earlier today that we don't really need politicians. We just need leaders that understand really what it means to be a public support, that have no vested personal conflicts of interest. It's great to be passionate, but that passion must have a purpose. We need to take Marin General and look at it and fix the problems that are there. Thank you.
Great. Thank you, and thank you again to the League of Women Voters for this forum. What makes a great hospital is great care. This is not in the forefront of the private corporation who is leasing the hospital. In fact, there are rumors of layoffs, and who do you think will be affected the most? The executives, their pay? Not likely. Nurses are on the front line of care. They need to be listened to, and their challenges need to be addressed. We have to become the hospital of choice in Marin. We need a management attitude that supports our becoming the hospital of choice. The lease is a complicated issue, even for me. You can be assured that unless I understand it, I do not go along with it. And the best advice I can give you is if you don't understand Measure R, just vote no. In November, elect myself, Jennifer Hershon, and Joe Salama to take our hospital back. Thank you.
Larry Bedard.
Yeah. Actually, I think it's really simple. You've got three people, myself, Jennifer Rienks, Mike Whipple, who support where the hospital is going. We support Resolution R. We support an independent or a separate hospital board. You got three other people Let's consider what would happen if they won. You would actually have 3 people who would dissolve the hospital board, and they've been to a total of 1 meeting in 8 years. They've never been to a finance, they've never been to a lease and building. They're all opposed to the lease and the new hospital. You were against that last time. Why? You had 10 public meetings on the lease, you never attended one. What we're seeing is a throwback to the old days of McCarthyism, innuendo, there's thieves. Joe, you ought to back it up. You've made allegation of criminal behavior. You're citing unnamed sources, people at the hospital, that kind of leadership. And I'll just end what the nurses had to say. You're going to find out we got the same Mike and I and Jennifer from the doctors. You ought to listen to the CNA representative who at the last board meeting in the IJ said part of the reason the nurses score was because of the computer. But then she went on to say there's a lot of good things happening at that hospital. I see it every day. I hear it from the nurses every day. And she thanked the hospital for communicating about the computer program. So you can listen to a disgruntled nurse, you can listen to the CNA representative.
Thank you, Larry. All right, this ends our debate. Thanks to the Community Media Center for providing us with this studio. Thanks to the candidates for running for office.
Thank you, Ann.
Thanks to our timekeeper, Joan Brown. And thank you, voters, for watching.